Good morning, everyone, and welcome to the inaugural event of Engineering Impact. Today's event is Engineers' Contribution to Healthcare. I would first like to acknowledge that Dalhousie University is located in Mi'kma'ki, the ancestral Mi'kmaq. We are all treaty people. I am pleased to be introducing the faculty's new speaker series, Engineering Impact. I'm glad you could join us today for the kickoff event. The Engineering Impact series will shine a light on the many ways engineers contribute to and improve our communities. In doing so, we especially want to celebrate the contributions of Black, Indigenous, and people of color in engineering and women in engineering. Rather than a presentation format, we thought it would be more interesting to have a panel discussion format. I am pleased to welcome our student moderator, engineers representing diverse areas of healthcare, a variety of career stages, and a mix of engineering backgrounds. Today, our panelists will be sharing their knowledge and answering questions about current engineering roles in the healthcare industry. What is the future of engineering in healthcare? And what more can we do to inspire the next generation of students to become engineers? A couple quick housekeeping items before I pass the conversation over to our moderator, Gizem. In addition to our prepared questions, I encourage you to leave questions in the comments section that will be answered in the audience Q&A portion of the event. Now, I have the extreme pleasure of introducing our moderator, Gizem Koja. Gizem is a graduate student in the Department of Industrial Engineering. She'll be introducing our panel members and guiding us through the discussions. Thank you. And Gizem, over to you.
Thank you, John. Thank you, everybody, to joining us. It is a pleasure to me to introduce our greatest panelists, Brian Darrell, Bae Bintoy Kara, and Noreen Kamal. Would you like to introduce yourselves to us to know you better? Noreen?
Thanks so much, Gizem. So my name is Noreen Kamal. I'm an assistant professor in the Department of Industrial Engineering. I actually have around 10 to 15 years experience working in the healthcare sector across Canada, including British Columbia and Alberta. And before that, I also worked in industry as a consultant working in process control. So that's a little bit about me.
Thank you, Noreen. Bintoy, could you please introduce yourself?
Good morning, everyone. My name is Bae Bintoy Kara. I'm a chemical engineering DAL graduate, so that's always exciting, from 2018. I currently work as an engineering training in industry and surface operations of a potash mining company, and I'm here to talk more about a startup that I co-founded called Gap Health.
Thank you, Bintoy. And finally, Brian, could you please introduce yourself to us?
Good morning. My name's Brian Darrell, and I'm Senior Director for with the Department of Infrastructure and Housing. The name of the department changes almost on a bi-weekly basis, so I had to pause for a moment to think what it was this week. My role is primarily in the design and construction of hospitals and healthcare facilities around the province of Nova Scotia.
Thank you, Brian. Thank you for our all panelists for the introducing themselves, and I think I can start with my first question. My first question will be as an engineer, what is your role in healthcare? Bintoy, could you please start?
Yes, thank you for that question. I'll start with what the definition of an engineer. So an engineer is any person, it could be anybody that invents, design, analyzes, builds, and tests. So my specific role is to challenge, redefine, and design. That means is bringing my whole self and my experience into the space and create something that's applicable to different people. So as a co-founder of Gap Health, what I do is we're building a startup that is using mobile technology and artificial intelligence to bridge access in healthcare in Africa. We're giving people tools to track their medical activities while providing a safe way to store it. These data would be used to build insights for the actual patient, which would be the user, and also better understand how diseases manifest in these regions. We'll be focusing on non-clinical diseases and diabetes as a focus for now. As part of this application, we also have a telemedicine portion of it, and this is because these individuals need access to quality healthcare. So we're providing that to them by having them contact verified providers through SMS, voice, and video.
Thank you, Vinto. Thank you for your wonderful answer. Noreen, could you please answer this question?
Perfect. Thanks, Kizam. So, Bintu, you started with a definition of engineers, and maybe I'm going to expand that for industrial engineers. So, engineers make things, or design things, whereas industrial engineers make things better or improve things. And that's really where my role in healthcare lies, is around quality improvement within healthcare. And I've worked almost for the last, I would say, 7 years in the area of stroke, and acute stroke specifically, where in ischemic stroke, it's actually a treatable disease, but minutes matter. So this is where you really need to have processes that are fast, and in fast we mean minutes fast. So I have worked to reduce treatment time from arrival to hospital to a median of 30 minutes, and really where this work had the greatest impact was in patient outcomes. So we want to reduce disability, we want to reduce mortality for these patients. And it seems a little bit odd that engineers can save lives, but indeed we do have a role in healthcare to save lives. And I really find passion in doing that.
Thank you, Noreen. And Brian, what is your opinions about this question?
Actually, the role of engineering in healthcare is universal. In fact, we play almost as an important role as the actual physician. Once you arrive within the facility, you might have a physician who looks after you, or a nurse practitioner, but the whole aspect of how the building is designed, what the roles of how the various rooms are adjacent to each other, the equipment that's in the rooms that you actually use, that all comes through the engineering process. And you cannot actually imagine the importance of that. Let me just give you a quick example, and I apologize if I'm taking too long. Something as simple as the humidity in the room is so critical in the wellness of an individual. If you were to look at the CSA standard for Z317, it actually gives you a range of almost 40 degrees difference in terms of the level of humidity in a room. But did you recognize that by actually having a room too dry, it actually causes the surface of the wound to dry out and to cover over before the actual wound has actually healed on the inside? And the result is that the patient actually spends longer in the hospital than if the room was more moist. Who actually looks after this? This is the role of an engineer. We can talk about the actual food, because when someone goes into a hospital, what's the first thing they say when someone comes to visit them? The food was terrible. It's cold here. The whole aspect of actually getting nutrition to the individual, the whole aspect of keeping the room warm, is all controlled by engineers. It's those things that actually shorten or lengthen the amount of time that an individual spends within the hospital. So even though physicians are important, you can get rid of those with them for a few minutes and just focus on engineers in the building, and you will actually have a reasonable outcome in terms of success.
Thank you, Brian.
That was a very biased answer, though.
Yeah, exactly. That was so wonderful answer, and exactly our roles as an engineer. My second question actually will be what opportunities exist not locally, nationally, and internationally for engineers in healthcare industries? Noreen, could you please start?
Sure. I agree with Brian, and this question actually builds quite nicely from that. I think that the opportunities are really dependent on the engineer and the type of engineer you are, and really where you want to contribute in healthcare. I'm not sure if it's really limited in any significant way in any area, but I'll speak from an industrial engineering perspective, and specifically Atlantic Canada and Nova Scotia, I believe, has done a fantastic job of showing the health authorities and showing the health system the contributions that industrial engineers can have to the health system. And in fact, there is a department within Nova Scotia Health that is made up of industrial engineers looking at improving processes, optimizing the services that you give. So certainly there's opportunities locally, but it's not limited in this very specific way at all. And I came from a West, there weren't any industrial engineering programs, and really I was often the only engineer in the room. And it was really for me to find these opportunities and show the contributions that I can make.
Thank you, Noreen. And Brian, actually, I'm curious about your opinions in this question too.
I think that the opportunities at this particular point in time for people interested in engineering and engineering and healthcare are limitless, actually limitless. Not only are we seeing the whole role of engineers in the hospital setting, but we're seeing engineers actually in the pre stages, okay, in terms of the design and facilitation of the pharmaceutical processes. We're seeing them in terms of the design and of the equipment that goes into it, into the hospitals. If you have any kind of inclination and want to be involved in healthcare at this moment and have an engineering background, it doesn't even have to be engineering, a technical background. There's tremendous opportunity, not only in Nova Scotia or in Canada, but I think on an international basis, because Canada is very much leading the world in many aspects of healthcare.
Thank you, Brian. And in final points, Bintoy, you mentioned that your company has an African health system help. And can you please share your opinions about this question?
Yeah, so I come into healthcare in a very unorthodox way, and maybe I can relate with people that you're unsure, right? So when I graduated Dow with a chemical engineering degree, I knew I had a degree and a skill set to enable me to think in a certain way and solve problems. However, I was unsure what that equates to in terms of a career, but I knew also the problem that I wanted to solve. So over time, like I talked to a lot of people, like mentorship, and then I also found a bridge of where I am and where I want to go. And I think that's where I can see with anybody with engineering or a skill set. So what exactly do you have and how do you want to change it, and using that as a bridge? So as Brian had mentioned about healthcare and some of the things you don't even think about. So I was reading this article recently about in Regina, because I'm in Saskatchewan right now, they have drive-in COVID-19 vaccination, and all the planning and the routes and how that's done is actually done by an engineer. So somebody may not think about that. So I think it's more of like, what role do you want to play and how do you want to do it, and what skill sets do you need to get you there? And that's how I created my startup as a result of it.
Thank you, Bintoy. And my third question will be, what does the future look like for young BIPOC students interested in pursuing engineering or careers in the healthcare industry? I would like to start with you, Brian, because I know that you have so wonderful ideas about this topic.
Thank you. Now, my concern here is to make sure I give time to the other two participants to give their views. But the role for a BIPOC student is incredible at this moment, because for the longest time we've actually assumed within healthcare that a patient is a patient is a patient, and that's not necessarily the case. I want to talk for a few minutes about the whole aspect of an OR. Now, an operating room. We tend to think that operating rooms are very generic. One size is good for all, but that's not actually the case. If you look at the Black community, you would tend to look and what diseases actually typically attack them. You'll find that it's typically hypertension, it's diabetes, and it's cardiac issues. those are things that are unique. Well, they're not unique, but those are things that you'll find very prevalent within the Black community. If you were to look at various other cultures, you'll find that it could be a gastronomic issue, or it could be a liver issue, and not all operating rooms are the same. If you're actually going to be in a facility in a Black community or close to a Black community, you'd want to actually fit out the room so that it can actually handle, or it could be most meaningful to those cardiac issues, because the way you'd set up a room in an African Nova Scotian community is completely different the way you'd set it up in a more mainstream community. If you look at simple things like the height of the toilet seat, if you look at things in terms of the temperature within the room, the number of people you have in the room, like if you were to go to a First Nations community where it's a great deal of communality, you'd design the room to be larger so that there can be more people who actually visit the person because they're very communal. So, I mean, the design of a room, the design of the facilities, even before you get to the hospital in a long-term care facility or in a clinic, is very key in terms of the community. You have to look beyond just the mainstream. A book approach to it, a textbook approach to it, doesn't work. You have to know your audience.
Thank you, Brian. Actually, as a young engineer, I want to move to you. Bintoy, what is your opinions about this question?
Definitely. I feel when people design, they should bring their whole self to it. That means they need to bring their experience. So when I design, I bring this aspect of my cultural competence, which Brian alluded a lot about. For example, with the Gap Health app, we added a feature where you can add your family members. In the communities that we serve, healthcare is not singular. You need a support system, and your support system also helps you be accountable to what you're supposed to do to improve. So that's something that is very intentional. And another thing is also being very conscious. And historically, we know BIPOC individuals are almost on the receiving end of the impacts. And there've been a lot of news around AI biases in healthcare and some of the faulty metrics that have been used around cost as an indicator of how serious the care is. And we know that's not true because people may not afford to pay for it. However, that doesn't mean their health condition is not serious. And those are detrimental impacts on increasing the gap of inequality. And another thing which we're working on is the availability of data. So these AI systems are trained based on data. So how do we collect data, a wide range of data from different demographics to make sure when they're working for everybody? And it's wholesome.
Thank you, Bintoy. And finally, Noreen, do you want to add something more?
Maybe I'll just be super quick. Those are such rich, fantastic answers from both you, Bintoy and Brian. I think just addressing what does the future look like for young BIPOC students, I would just say it looks super bright. I think that I just want to encourage BIPOC students to pursue careers in healthcare. I think representation is important for all the reasons that we were just talking about. So yeah, I'll just leave it really simple at that.
Thank you, Noreen. And my next question is that how did each of you decide the healthcare industry was the area of engineering you wanted to build your career in? For this question, I want to start with Bintoy. As I know you are a chemical engineer, actually, maybe you will give the more idea for the other chemical engineers to pursue career in healthcare industry.
Yeah, so as I mentioned, that my way is quite unorthodox. So when I graduated, or initially when I started my chemical engineering degree, I dabbled a lot around, do I want to go to medical school? Do I want to do a PhD? Because in my mind, you need to have a certain skill set before you can do something. And talking to a lot of people and from my own little, maybe lower experience from most of the people in this panel is that is not always the case. And instead of thinking about it in that way, I thought about it in a very different way is what am I trying to do? And where am I right now? So with my chemical engineering degree, it gave me certain skill sets, which I still use, like problem solving, using process design, process optimization, all those skills. And I use that to do what I'm doing now, which is also solving problems, but in a very different way, where I am using my skills with like process optimization, and I also have a partner who comes in from a biomedical engineering department and has those skill sets on how the functionality works. So my decision to go into healthcare is an issue that I've always had on using medical technology to solve problems for a wider range of people. And that's where I transitioned from, okay, thinking about medical school, where it's the person you attend to, the person you see at that time, to how do I solve the problem for many more people, even when I'm not there? And that's where like engineering came into handy, and the technology aspect of it.
Thank you, Vintoy. And Noreen, what is your ideas about this question?
Yeah, so Bintu, that's exactly right. So a clinician often has that one-to-one interaction, and they're trained very well to address that physician to patient type interaction, whereas engineers are really systems thinkers, aren't we? And we like to see healthcare from a systems perspective, which is completely unique yet so valuable. So I just wanted to tag that on to that response, because I thought that was so wonderful. In terms of my decision to enter the healthcare system, it was really a decision based on my own personal values. I was working in consulting. I was traveling the world, building process control systems for large industrial facilities. And I personally did not feel fulfilled in that particular role. I wanted to contribute to society in a way that impacted people and impacted individuals on a more direct level. And I wanted to move away from pure profit motive. So really my desire to shift from industry into healthcare was really altruistic in a way, and to align my personal value system with what I was doing in my day-to-day life. And I got to say, I look forward to waking up every day and going to work. I think that every single person, and as engineers, we can strive for that. It may not happen immediately after you graduate. I think it's great that you've been able to achieve it so early in your life. For me, it wasn't that way. Like, I started my PhD 13 years after completing my master's degree, and I had a wealth of experience. And I realized that when I pursue a PhD, that is going to be in an area that I'm passionate about. And it took me that long to find my research passion in healthcare, which is when I pursued a PhD at UBC in the area of healthcare.
Thank you, Noreen. And in final point, Brian, what would you like to add in this question? How did you decide?
The two ladies have actually said virtually everything that I would say, except the only way I could add to it was that mine was somewhat selfish in a sense. I enjoy working with people, and I've built a number of different structures in my life. What I found really interesting was that you build a private hotel or a private facility, and you're building for one person. But when I actually ended up working, building a hospital, one of the first projects I did, I found the whole community came out and wanted to be engaged. And people were giving me advice and telling me how I should do things, and who just happened to be walking along the street because they felt connected to the facility. The hospitals are really for the community. It's not for an individual. And I'm saying, anytime you can get that many people trying to tell you what to do, many times it was not right, and I would have been further ahead if I had completely ignored them, which I did. You have to say, this is something that the community wants. This is something that people want. And so it is really enriching to do something there where you've got the whole community behind you, supporting you. And you go a little bit over cost, they're willing to forgive it because it's for their benefit. That's not the case in private practice in many cases.
That's wonderful answer for three of you. And my next question will be how would you, as a BIPOC, affect design in healthcare? Let's start with Noreen.
Yeah, I think we touched on this when with a previous question around how does the future look for BIPOC students, and I'll just sort of say, I think our experiential knowledge as BIPOC individuals have a significant role in the design of healthcare. And I'll just speak to it from a quality perspective. There's various dimensions of quality that have been laid out and are followed provincially. And I think that critical to this is around access. So on a very, very basic level, people see access as purely getting your healthcare card and then you have access to healthcare. But it's really not that simple. There are barriers that exist specifically for BIPOC people that only we would understand. There's cultural barriers that current healthcare systems may not be designed to understand these cultural contexts, and language barriers that exist. And then also distances, specifically for Indigenous people. You know, we have built a colonial system. We have to understand that we live in a colonial world, and how are we providing access for on-reserve Indigenous people to access our healthcare system? And that's only one dimension. There's multitude other dimensions of quality that play into this that we need to consider when we're designing healthcare systems.
Thank you, Noreen. Brian, I know that you have already mentioned your ideas. Could you please give more insight about them with this question?
One of the things that's very exciting about taking those things into account is recognizing that when you, as I said before, when you're in a healthcare facility, your system's under a great deal of stress because you don't know what the outcome's going to be. There's you're at a hyper acute state. Having an environment that actually reflects and reflects you, reflects your personality, your environment, your culture. It goes a long way to actually relaxing you, making you feel more comfortable, and actually makes you more acceptable to receiving medication. One of the things I would really like to share is the whole concept of a long-term care facility that we're working on in Eskasoni that's being built in the shape of a turtle, which is important to the Mi'kmaq culture. And it's just wonderful to see this facility designed to resemble a turtle. It actually will have two kitchens in it, one that actually can process native game, and one that can actually handle the conventional food on a regular basis. Seeing that they're actually taking the time, the care to actually have it reflect the culture that it's in the environment, in the community it's in, is so important. So I'm just looking forward to seeing how that's going to foster the care of the community there.
Thank you, Brian. And in final point, what would you like to add, Bintoi?
Yeah, I think most of my comments have been spoken already, but something I'll just add is just having a user-centered approach where, one, you're checking with yourself, who is in the room, who is here, and who are we serving by doing this? That way, once you find a disconnect, you know there's a missing voice, and you need to be very intentional in finding that piece, because these things, whatever you design affects, there's a user at the end that's going to be affected. So you want to make sure you're very intentional about how you design by thinking about the user throughout the process, not just at the end, because it does affect how you design it.
Thank you, Brian. And my last question will be, how do we get more STEM classes into schools, especially schools with higher representation of acuity deserving groups? I want to start with you, Bintoi.
Yeah, I don't know if that was intentional because I'm the younger one here.
Oh, no.
I'll go ahead.
It is just unintentional.
Okay, I guess for me, what I'll say is being relatable. So originally when I was thinking about doing engineering, I couldn't relate to mechanical moving parts or civil or building, because in my mind, that's what it equates to. When I do this degree, this is my job. And I couldn't relate to it. So because of that, I was very reluctant on actually pursuing engineering. And as I knew more about it, I knew I can just use it to solve the problems I have, which we all have, and then in a way that I am part of it, right? So I think the way we can do it is we need to make it relatable and do it in a way that's very intentional. So I'd say the recruitment, like who is there, what are we talking to them about, what projects do we have in schools, like what's the pedagogy, do we have a project that people can use maybe to solve what the bus system looks like in Halifax, because that's what they use every day and they may think there's opportunities to improve it, or do we just use it as a project that something cannot relate to, right? So how can people bring in their whole self? And another thing is mentorship. So I had an amazing experience at Dalhousie, and one of the things that I don't take for granted is the mentorship I had. And something that I think is very helpful is Imhotep's Legacies Academy mentorship program. So what they have is they have younger students where they get mentored by university students that look like them. So I really believe what you can see, you can be. And then these university students also have access to professors who mentor them. So at the end of the day, you have a whole community looking after you. So during your struggles, you know you're not alone because you have somebody else that you know that graduated, and then you can as well. And it also gives you access to the tools. So my answer to this is, how can we be more relatable to the people that we want to come into these spaces? And then when they are, how do we make sure they stay in the spaces by making sure they're successful through some of the examples with mentorship and a safe space where they can bring in their whole self and foster belonging to be as successful as they can.
Thank you, Vintoy. Noreen, I would like to continue with this in this question.
Sure. So I think in terms of having STEM classes in school, that is the role of government. And as the public, or as citizens that are voting in these governments, we really need to hold them to account. I don't have the statistics. I'm not an expert in this area, but I have heard that higher physics and mathematics classes are not available in Indigenous community schools. They're not available in historic African Nova Scotian communities. This is a huge issue that's really up to the government to solve. And I find that atrocious, right? Like we really need to ensure that everyone is having access to STEM classes. So that's on the political front. Now, I completely agree with everything Bintu is saying. Like, students, in order to make science and math and engineering interesting for students, is we need models. We need models that look like this panel to the students. We need to make it interesting and relatable. However, I also think we need to get rid of biases. And maybe I'm just a little bit older and it's gone, Bintu, but when I was going through school, I heard things like boys like math and physics and girls like language arts and social studies. You know, these types of biases, I think, are very, very harmful. So, like, well, I like math and physics. Does that make me weird? I think I was fortunate that in my household, you know, we were very open to women achieving great things and not limiting us to a certain career paths. But certainly I heard it going through school in Canada. And I think biases can be extremely harmful. So we need to make sure our teachers are not promoting these types of biases in the classroom.
Thank you, Noreen. And in final point, I'm curious about your opinions, Brian, about this question.
I'm going to try and be very sensitive here to the education system, but a lot of I agree 100% with what the previous two panelists have said. But I think also a good component of it would be opening up our eyes to the way STEM classes carries over into other areas of education. When you actually look at music, for example, you cannot be in a music environment without actually thinking about the math that's involved. You cannot be in an English class without thinking about how the language is structured and the how it's actually put together. I mean, that's a pattern. That's actually recognizing the correlationship between the various different aspects of it. STEM actually goes much more than just math, sciences, and hardcore technical subjects. If we actually instill or inspire our teachers to look at how the various STEM courses can be, how it goes right across the whole education system, I think we'll be doing all of us a tremendous favor. But I agree 100% with the other two panelists. I mean, they were bang on. I had to add something that was a bit different.
Thank you all of you for the answering my question with the wonderful ideas. Now, whether you are watching on YouTube or Facebook, please leave your questions to us and we can ask to our panelists your wonderful questions too. And our first question is coming from Emera Idea Hub. Are there unique barriers BIPOC students face, and are there things we can be doing as a community to help? Which one of you want to start? Maybe Brian?
Certainly. I think the real challenges in many cases that a BIPOC student face are before they even make it to university, before they even get into the engineering program. And that's just getting a chance to, as Noreen was saying, to get into those courses, into the classes that offer you the STEM courses, getting that training before you get in. I see so many wonderful young students that are excluded or steered into a more mainstream type of program. And so we actually have to change that. We actually have to say that we want those students to be engaged in the full enriched program.
And Bintoy or Noreen, do you want to add something more? Noreen?
Yeah.
Actually, Bintoy.
No, sorry. Yeah, I was going to ask Bintu to speak since she was most recently a student. And
sure,
yeah,
please continue.
I was waiting for you to just choose me for this one too. And I'm like, what's going on here? Okay, so and I'll talk about my own personal experience. And I think also through my mentorship program, when I was mentoring students in high school through Imhotep DAL. And what it comes is the biases where certain people are expected to be at certain places at certain times. And I think that's very harmful because more than anything, people need a choice. So how do we equip all students, especially BIPOC students, with a choice to make, right? And that means we have to be, and when you're helping them make this choice, you want them to make the best choice, right? So as a result of it, so providing them with certain skill sets, that way they're successful. And because I know sometimes they go to guardians council and like, no, don't go to university, go to college. And I'm like, no, you can be in university. You can do it. You can take a full course load. So how do we equip these individuals, which make a huge impact in these students' lives with skill sets, that way they can help them be successful? Another thing is their communities. So a lot of outreach around what this means, right? So how the student can be successful and what role do these communities play for them to do that is another idea I have. And another thing is when they come in, like how do we make sure they're safe? When I was at DAL, I always went to the Black Student Advising Center because more than anything, I meet other people like me and I was very comfortable so I could bring my whole self. So within these communities where we know for the longest time it wasn't inviting for these individuals to come to the space. How do we make sure they're safe when they're there? And if they're not, like how do we hold these people accountable to that as well? So those would be the points that I'll add.
Thank you, Bintoy. And finally, Noreen, would you like to add something more?
I mean, I'll just add it from someone who is in Dalhousie and teaches courses to undergrad students. Is really, I think we need spaces for the instructors and the professors to understand these barriers so that we can then design our courses to ensure that we aren't creating barriers for BIPOC students. Instead, we are tearing the existing barriers down. So I think that's a challenge for us in the Faculty of Engineering to make that happen.
Thank you, Noreen. Our next question is coming from Kathy Cameron. Has the pandemic impacted the role of engineers play in healthcare? If yes, how? I would like to start with you, Noreen.
Sure, yeah. I think that we have played an extraordinary role throughout this pandemic, and we will continue to play that role. And I think I've been involved in a number of projects that include modeling and the use of simulation, system dynamic simulation in particular, to understand the spread of the disease and how different policy options can minimize mortality and minimize the number of people that have been infected. So this is one where we're working alongside epidemiologists. I think supply chain is another one. Started very early with, oh my gosh, we need ventilators, we need masks. How do we procure these items that we thought we had enough of, but now we need enough to sort of have enough for the hospitals, but also for the public as well. And now, of course, we're seeing it with the rollout of the vaccines. So I think this pandemic has really highlighted the role that engineers do play in healthcare.
And Brian, what is your ideas about this topic?
Many years ago, I taught engineering economics at Tun Sur Dal, as it's called now. And one of the courses, one of the things that I kept on stressing to the students was that they could take all the technical courses that they want, but engineering economics has got to be the most valuable course that they'll ever take, because the same principles involved in it were current during Christ's time as they are now. If you actually look during the pandemic, what has happened was that many projects were shut down. They were just terminated for a period of time. Even though they were terminated, the project had started. The cost of that project continues to go on. So you're paying for a lot of downtime. Engineering, what we actually had to do as in our engineering group was find a way that they could continue the work. Construction crews could come on site and work in the project without actually interfering with the other ones, that they were socially distant, that they could come into the healthcare facilities and actually continue to build and work on it while during a pandemic in one of the most sensitive areas in the world of construction. So the designing of those routes, designing of the protocols that would allow a person to actually feel safe and comfortable working in that kind of environment was left up to engineers and infection control specialists. So yes, it played a very important role. That's why we were able to keep the economy rolling. That's why we were able to keep the projects moving without actually just going into a complete shutdown and building on a tremendous expense. Like, let me just give you one example. For 1 month, you were talking over $3 million just in terms of the cost of financing that debt. So, I mean, it's a tremendously expensive thing. So it's something that had to keep going.
Thank you, Brian. And in final point, would you like to add something, Bintoi?
No, this was very intensive. Thank you.
Thank you. And our next question is coming from Dr. Cyrus to Bintoi. What is the status of Gap Health, and are you running a pilot?
Okay, so where we are right now with Gap Health is we're going through a testing phase. And as we all know, testing always takes longer than anticipated, especially with the software. So we're going through alpha testing where my co-founder and I are measuring the metrics on the app across with the design proposal. And then we're all prepared for the beta testing where we have a closed knit of people, both health providers and practitioners, that are friendly to us and honest, that they will look at the app, and we also have metrics that they would be giving us feedback. Following that, we'll be going through a pilot testing where we have 2 hospitals in Gambia and 3 in Ghana where we'll be doing the pilot testing. And we're hoping by the time we get the app to them, it would be in the best shape we can.
Thank you. And our next question is coming from Haley Matthews. I think it will be great to arrange something throughout the year for BIPOC students in high school to find out more. Would any panelist will be interested in hosted events like this for the students? Bintoi?
Yes.
I think all panelists are going to be interested in with this.
My regret on that issue is that frequently we get a request to come to high schools within the Halifax region. There are some absolutely wonderful students in rural Nova Scotia, and if it was a chance to use virtual technology such as this so we can speak to students outside of the HRM area, that would be absolutely wonderful.
Thank you. And our next question is from Carl Karam. And is it easy to find a healthcare engineering job after a civil or industrial engineering degree? Brian, what do you think about this?
I would say yes, it can be, depending on the inclination of the student. Civil, the fact that you're civil is not a problem. We'll forgive you, okay, that you made a bad choice early in life. However, what I would encourage you to do is to, for all engineering students, is to work on your writing skills. The biggest problem that I have when I'm hiring new students is that they're very bright, but they cannot put a sentence together. As an engineer in this profession, you have to be able to write reports. The ability to actually say concisely and clearly what it is you want to, the point you want to make is so important. So work on your writing skills. And yes, I'm sure we can find you a job.
What do you think about this, Bintoy?
Yeah, I think something that I add is the skill set that you need. As I'd mentioned earlier, is I was focusing a lot on my degree. So what can a chemical engineer do instead of saying, okay, what skills do I need in order to get the job that I want or the job that I create? And writing is one, like communication is another. Just being like also making sure what value do you add? So why should the person hire you? And what skill sets do you bring? Because at the end of the day, it ends up being that value added piece where you should bring a certain value set to that role or that department for them to have you. And that's your job to sell that.
Thank you. And finally, Noreen, I know that before being an instructor to Dalhousie, you worked as an engineer. What do you think about this? Is it easy?
Yeah, so I'm just actually going to focus on the second part of this question, which is or industrial degree, and say absolutely. As an industrial engineer, the word easy, I don't know. I don't think life is ever easy or there's any fast track. It really depends on the individual's motivation and desire to do it. But in industrial engineering, absolutely, there's careers in healthcare. In fact, I teach a 5th-year elective course on optimization and design of healthcare systems. So industrial engineering, you know, there's 2 of us on the panel from that particular discipline. So it's a fantastic discipline for career in healthcare. And
I definitely.
I'll just sort of add, thank you so much, Brian, for saying that about writing. I could not agree more. I have students write a lot in my courses, and I find the engineers to be a little bit reluctant. But I'm an engineer. Why is she making me write 500 words? And it's like, 500 words you should be able to write in your sleep. This shouldn't be a big onerous task, right? So you really do need to improve your writing, no matter which field you're going into. But certainly, we don't want bad writers in healthcare. So thanks, Brian, for making that point.
Thank you for these wonderful points. Our next question from Dan Templer. What are plans and timeline for tearing down the old VG structures in Halifax? What will replace that hospital, and what role will engineers have in this? I think, Brian, you will have detailed idea about this question.
I do, but I'm not going to share it, okay? I'm sorry, we're not going to talk about that. Let's get the current facility up first.
Okay, and the next question is coming from Lauren Turner. How can we work to broaden the understanding of what engineering is and bring awareness to the different fields like healthcare in which engineers work? I want to start with you, Noreen, for this question.
Yeah, sorry, I'm just trying to understand what's being asked. Broaden the understanding of what engineering is. Yeah, I mean, I'm not sure if you mean within the education system or within society. I think definitely the public might have its own understanding of what engineers do. Like I know 20 years ago, people were asking if I was going to be a train conductor or something like that. I think a lot of that maybe doesn't exist anymore. So certainly there's a role within ourselves as engineers to show the breadth of work that we do and we're capable of doing, and really highlighting that. I mean, I've had experiences with certain healthcare or engineering associations when I sort of say, oh, did you want to highlight this healthcare project? Where they were actually, no, we kind of wanted more hard hat and steel toe boot projects, you know. So it's really about broadening our understanding of engineer and our role within that as engineers to make sure that the public understands that.
Thank you, Noreen. And Bintoy, I know that you mentioned before that you already changed your understanding for the engineering point. What would you like to add for this question?
Yeah, I think the thing is just making sure the information that we're sharing is inclusive, right? So so instead of just putting it out there and expecting what people take out of it, like sort of reverse engineer it with, okay, what do you want people to take out of this? And then what do you need to provide them to do that? And whether it be in your education classes, like, so what projects do you have? Let's say if you have a poster up, what type of poster do you have? Who is in there? Who is not in there? So just being, more mindful of that on like what information you're portraying and what you're putting out there.
And thank you, Bintoy. And Brian, do you want to add something more?
I think the two ladies have said virtually all of it. So I'm going to keep quiet.
Thank you, Brian. Our next question is coming from Dr. Cyrus. How has the optimization helped during the pandemic? Noreen, you mentioned that you already being involved for some simulation and projects for the COVID. Do you want to give us more idea about it?
Sure. So, I mean, optimization has helped in numerous areas. I think supply chain is a big one, but also optimization and that. If we want to think of it as a dual objective optimization function, where we want to minimize the impact on the economy and at the same time reduce the number of infections that we have, because the two things are really at odds with each other, right? We can certainly open up the economy entirely, but then that's a huge cost to the people, the infections, and obviously our strained healthcare system wouldn't be able to handle that. And finding that balance is definitely one area where we've contributed to in terms of modeling.
And what do you think about this, Bintoy?
Yeah, I think something that I'll add is we all use optimization indirectly, right? So it just means like, how do you manage your risk? And I think we've seen that based on how you work. Some people may have gone on site, others are working from home, and so indirectly, let's say the decisions you make every day, you are trying to find the most optimized way of doing it. It is maybe how many times do you go to the grocery store, right? Versus maybe you're doing bulk shopping. And then another thing in the bigger scale is, and I actually went to visit in Regina. So they have a drive-in vaccination, and just how it's designed is very beautiful. Like, it was closed when I went there, but I just had to admire based on how many lanes and how many people are serving them at any given time based on the peak time. So it's used, we all do it in a small scale. Even if you don't think about it, it's being done in a way that's intentional in your company and how they're planning, and the government and the world and how they're opening up as well. So it's all over.
Thank you, Bintoy. And Brian, do you want to add something more?
It's very difficult adding anything new with these two ladies because they cover everything. But what I would throw out is that during the pandemic, it has forced us to think about new ways of doing things. We're exploring avenues and methods of achieving the same goal that we wouldn't have thought of if we had not been in a pandemic environment. So yes, it has actually opened the borders of optimization.
Yeah, I'll just sort of add to that, Brian. I think that's such a fantastic point. I think it's forced the healthcare system to be a little less conservative, and I think we've definitely seen that with virtual care. And I think virtual care is here to stay. For a quick consult, why can we not just get on the telephone with our clinician? Why do we need to take 10 buses to go to our family physician or family clinician. So things like that, I think it's actually helped us to get out of our conservative bubble a little bit.
Thank you for three of you. And just right now, we are going to share some comments from our audiences. First comment is coming from Margaret Palmeter. Incredible to see the many ways engineering skill sets can be deployed. Thank you to this great panel. And Alexa McDonald, Bintoi, I love that perspective of having an impact on patients and care when you are not there. And Imhotep's Legacy Academy, what you can see, you can be. Mentorship is important. Thank you, Bintoi. Writing communication, know your value and sell it.
Is this the Bintu fan club?
I'm the younger one here. I could guess I can get a pass that I was able to circulate it.
And now we are backing to the questions. Additional Put asked that often the team members of a project or part of the curriculum are the same or similar background. Does Dalhousie encourage cross-team projects and provide a platform for the same? Since Noreen, you mentioned the sum, I would like to start with you.
Yeah, I think that's a great point. I think what we often do is we allow teams to self-select, and actually, and we talk about this in our department. That's often not the best way to make teams, and I think we want to sort of move away from self-selection of teams. It's not really how the real world works. When I get a job, I get assigned to a team, right? And really, I think we can look at different people's skill set and sort of assemble teams based on their skill set. But the dimension of background, I think, is also a good one. Are you an international? Do we have a representation from an international student? Do we have representation from a BIPOC? You know, like things like that can also be an important dimension to think about within the curriculum in the formation of teams.
Thank you, Noreen. And Bintoi, we mentioned that you recently graduated from Dalhousie Engineering. What would you like to add during your course projects or other projects in the department?
Yeah, I think by default, people choose somebody with similar backgrounds, and that's just how it works. So in order to make sure that doesn't happen, because then that creates the biases that project over the career of that individual, we want to make sure not only does having different people add value to the project, I think it also adds value to the person they may become as a result of it. So I don't remember exactly what happened with some of my projects. I think some of them were self-selected, others you selected yourself, and it was just the people that you hang out with or the person who sat next to you is the person you choose versus somebody else that, let's say, went to high school in that community, they have friends that they know, so it's easier. And then somebody else like me who was an international student, maybe it was a little bit more difficult. So most of my group was international students because I knew them from societies or other involvements on campus. So I think it'll be helpful to everybody and the value of the project by being intentional, having different people to it, and then also encouraging people to bring in their whole self to it. So how do we make sure there's a guideline, but also it's not fixed enough that everybody ends up coming with the same solution?
Okay, thank you, Bintoi. And Brian, what is your comments about this? What do you think?
I want to share with you the background of a project I'm working on now. I'm not going to bother mentioning the community, but we're combining a number of different facilities together. We're combining a high school, well, it's grade 6 to 12, a long-term care facility, a primary care facility, a food bank, and a community center, all in the same facility. And the idea behind it was by putting all of these things together, we're really addressing the aspects of social health in terms of looking after the full aspects of the community, not just the physical and the mental, but the whole aspects. And that project has been a nightmare, okay? In a positive sense, but we have so many people that are convinced as to what the goal and objective of the project is, and we're getting so many different thoughts coming together. It's just getting to the design stage or getting through it is taking a lot longer than what was ever expected and what would ever want to actually go through on another project, but it's going to have a wonderful result, I think. I think the end result will be great, but when you have so many people with different goals, different objectives, different mindsets, different training perspectives, you're bound to have conflicts. You're bound to have a very rich environment in terms of a discussion. All I want to do is pour the concrete and drive the nails, but nevertheless, it's going to be a wonderful project when we're finished, I'm sure.
Thank you, Brian, for the answer of this question. Actually, this was our last question. I would like to thank our panelists and audience to answer the question and ask the question. And John, we are with you right now in an endpoint. Thank you for joining us too.
Thank you very much. And thank you, Gizem. You've been an awesome moderator for this event. And thank you to Noreen and Brian and Bintu for sharing your time and your insights and for just highlighting just a little bit your truly impactful contributions to healthcare and to the health of peoples in our communities. So thank you for that. We're very proud to have had you as the first speakers in this new series, Engineering Impact, and you provided an engaging and inspiring event, and I think set the bar very high for the next set of panelists in the next event. Thank you for everyone for attending this event and for providing comments and questions to the panelists. We appreciate that. We'll conclude the event here. I hope you enjoy the rest of your day, and we look forward to hosting you again at a future event. Thank you very much.
Thank you.
Thank you.
Thanks for having us.